So hello and welcome you all to Sail to MDS Dental Academy. I'm Dr. Manoj Trivedi, pediatric dentist and professor in College of Dental Sciences. So now dear students, we are going to have few parts. We are going to have good series regarding the MPPSC past papers, and at the end we are going to announce regarding our courses also. So these papers are authentic papers. It's a 2022 recent MPPSC conducted papers. So let's begin with the question and answer discussion in detail. So now the first question is about the diagnostic device is used for detection of dental caries. So on what principle it works? So remember dear student, it works on the principle of laser induced fluorescence. The name only suggests that this laser induced fluorescence involves emitting a laser light into the tooth. So what happened? This light will interact with the bacterial byproducts. So the carious tissue will fluoresce more. And normally this device translate this sign and symptoms into numerical readings. So you can easily understand that whether is a cavitation is there or cavitation is not there. Mostly it is used to detect early dental caries, or we can say the incipient dental caries. Now the second question. The most persistent microorganism that plays a major role in etiology of persistent periradicular lesion after root canal therapy is Enterococcus faecalis. Now it's a very common question they ask like this also, that Enterococcus faecalis is a which type of bacteria? Remember, it is a gram-positive facultative anaerobic bacteria. Mostly you can see in case of the failed root canal treatments or in retreatment cases. What they do, they form biofilms which is highly resistant to alkaline environment like calcium hydroxide, and they survive for long periods in nutrient deficient environment, and they can penetrate dentinal tubules, making it difficult to eradicate during endodontic therapy. Now third question. So what is the recommended post length for restoration? It is 2/3 of the length of the root. Remember dear student, the post length play a very important role in distributing forces evenly and providing the stability to the restoration. Mostly it is around 2/3 of the root length, which ensures sufficient retention without compromising the structural integrity of the root. Shorter post, what they do, there will be the risk of dislodgement, and if you take the excessive longer post, they weaken the root and they increase the chance of perforation also. So remember dear students, we have deal with the post length also in this question, and also what is the importance of shorter post and longer post. Now what is biological width? Remember dear student, it is a distance between the base of the sulcus to the level of bone crest. Most often it is a combination of connective tissue and junctional epithelium, which is around 2 mm. And you have to maintain biological width for periodontal health. If it is violated, it can cause inflammation, bone loss or recession. Now one more question. So which is the most accurate, reliable and reproducible method for determining pulp vitality? So it is laser Doppler flowmetry. Why dear student? Because this Doppler flowmetry will measure blood flow in the pulp. When your normal test like electric pulp test or thermal test, they used to measure nerve responses. Okay, that's why the LDF is a highly accurate method, wherever your traditional method are not that much highly accurate. Most often they are really unreliable in case of traumatized or immature teeth, that is with the open apex. Okay dear students, and remember what they do, they detect the RBC movement within the pulp chamber. Now who said that mandible is a group of microskeletal unit? So dear student, this is the question from the theory, that's a functional matrix theory. So it is said by Melvin Morse. Okay, so what he has suggested, he suggested that the growth is influenced by the functional need and soft tissue interaction. So the mandible is not a single skeletal unit, but a group of microskeletal unit driven by environmental and functional stimuli like the muscle activity, which regulate its growth. Now the very confusing question, so about the maxillary intercanine width. Remember, in male it continued to increase till the age of 12 years. Ideally if you see the textbook of the growth and development, they have mentioned around 13 years of age, but here there is no option for 13 years, so you have to go to the nearest option, that is 12 years. So till 13 years the maxillary intercanine width will increase. After that it remains stable. During what period it increases? It also increases from birth to 2 years and then continue to increase around 13 years. And after the permanent dentition erupts completely, there will be the slight decrease in the dental arch width. And remember, the intercanine and intermolar width do not change after 16 years in males. Now the Frankel appliance is what kind of appliance? It is a tissue bond and active appliance. Remember dear student, it can be used for mostly to bring the position of mandible forward, that is in class 2 situation. Sometimes the FR3 can be used for the class 3 situation also. Okay, so what they do, they transmit or modify muscle forces to the teeth and the supporting structures. That's why they are active appliance. And why tissue bond? Because they derive anchorage from the soft tissue, not from the bone. Now, according to Simon classification, remember this classification is a part of your classification of malocclusion. So it consists of 3 planes, which I'm going to discuss in later slide. So when the maxilla is closer to the FH plane, it is called as attraction. So dear student, Simon classification have 3 planes: FH plane, orbital plane and mid-sagittal plane. If something is closer, it is attraction, away, abstraction. In orbital plane, if it is closer, protraction, away, retraction. In mid-sagittal plane, if something is closer, contraction, away, that is distraction. So please remember this image so you can answer any question from the Simon classification. Now dear student, what is the full form of DICOM? It is a digital imaging and communication in medicine. They are used in medical imaging for storing, sharing and managing image files such as X-rays, CT scans and MRIs. Okay dear students, so that was all from my side. Part 1, we have discussed around 10 questions. If somebody is interested to join our test series, lecture series, they can join. You have multiple MCQs, images, videos, short videos which help you in the preparation. Okay, if anybody want any help regarding exam preparation, my information, the contact number and everything is there on the screen. Till then dear student, take care and work hard.